Good, happy Tuesday evening, February 9, 2021. I'm Riley King, and welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news, weather, traffic, and sports to get to this Tuesday evening, so let's begin. First up, we're going to begin with your weather. Let's see what's happening on radar this Tuesday evening. And as you know, it's been snowing during the day today. And as you can see, we are still seeing snow in New Hampshire, as you can see. So still happening out there. And if we look outside our studios, the snow's coming down at a good clip. Let's take a look. As you can see, the snow is coming down at a good clip. So still going on this evening. Your weather right now is snow, 24 degrees. And now let's take a look at that hourly forecast. And here's a check of that hourly forecast. Your weather for tonight, snow this evening will give way to clear skies, late, low 12 degrees, winds light and variable, chance of snow 90%, snow accumulation less than 1 inch. Tomorrow, expect a few afternoon clouds, mainly sunny, high around 30 degrees, winds northwest at 10 to 15 miles per hour. And let's take a look at that next 10-day forecast. And here's a look at the next 10-day forecast for all of you. And that is a check of your next 10-day forecast. And we have a winter weather advisory in effect until 10 o'clock p.m. As you can see, this is your winter weather advisory until 10 p.m. this evening. And we got quite a few closings and delays this evening. If you want to see that complete list, just go to wmur.com to see that complete list. And now let's take a look at your traffic map this evening. And here's a look at this traffic map for all of you this evening. In Henniker, you're seeing some medium-paced traffic. Hopkinton, medium-paced traffic with a little bit of smooth sailing. Concord, Bow, you're seeing some medium-paced traffic with some smooth sailing. Boscawen, Canterbury, medium-paced traffic with some smooth sailing as well. In Chichester, you're seeing medium and slow-paced traffic and a traffic issue. Road closed due to fallen power cables on Main Street both ways from Pond Road to Deer Meadow Road. In Epsom, you're seeing some medium-paced traffic. Northwood, medium-paced traffic. Lee, medium-paced traffic. Durham, medium-paced traffic, and another traffic issue. Road closed due to an accident on Main Street northbound from North Road to New Hampshire 155A Mast Road. Rochester, medium pace traffic. Somersworth, medium pace traffic. Dover, medium pace traffic. And another traffic issue. Delays of 4 minutes and delays increasing on Route 9 eastbound between New Hampshire 108 and New Hampshire 16A High Street. Average speed is 15 miles per hour. In Portsmouth, some medium and smooth sailing traffic. Portsmouth into Maine, medium pace traffic with some smooth sailing. Rye, some medium pace traffic with slow traffic and a few smooth sailing traffic. Northampton, medium pace traffic. Hampton, medium pace traffic. Seabrook, medium pace traffic with slow traffic getting into the border of Massachusetts. And that is a look at your ride along the seacoast. 101, we got some medium pace traffic all along here, and then some smooth sailing all along here. In Hooksett and Manchester area, medium pace traffic with some smooth sailing and a few traffic issues as well. Accident on I-93 southbound at exit 8 Wellington Road. Also delays of 3 minutes and delays easing on Route 28 northbound New Hampshire 28 and New Hampshire 28 Willow Street. Average speed is 15 miles per hour. Around the Manchester airport, some smooth sailing. And delays of 4 minutes and delays increasing on Route 28 southbound between Queen City Ave and New Hampshire 28 Willow Road. Average speed 15 miles per hour. Bedford, some medium pace traffic with slow traffic and a few smooth sailing traffic. Amherst, some smooth sailing and medium pace traffic. And Milford, medium pace traffic. Manchester, Merrimack, smooth sailing with some medium pace traffic and slow going traffic. And then you get towards Nashua down here, a lot of traffic issues as you can see. So take it easy along Nashua in the border of Massachusetts. Nashua, Milford, a lot of traffic issues here as well, as you can see, medium and slow pace going traffic. Manchester, Derry, Londonderry, some smooth sailing with a lot of medium pace traffic. Windham, medium pace traffic, and Salem, medium pace traffic into the border of Massachusetts. And then you get into the border, lots of delays there. That is a look at your evening traffic map this evening. Now let's get to your news. First up, let's get to COVID-19 updates. Let's take a look at those COVID-19 numbers for New Hampshire right now. There are 68,499 number of people in New Hampshire have tested positive for COVID-19. And there are 1,106 number of deaths from COVID-19 in New Hampshire and 179 current number of hospitalizations for COVID-19 in New Hampshire. And that is a look at your COVID-19 numbers this evening. Three more Granite Staters die of COVID-19. Cases and hospitalizations decline. As state health officials announced the death of 3 more Granite Staters due to COVID-19 on Tuesday, they said there is an ongoing evidence that the overall picture in New Hampshire is improving. Dr. Benjamin Chan, the state epidemiologist, said one of the deaths was associated with long-term care facility. There have been 1,109 deaths associated with COVID-19 in New Hampshire since the start of the pandemic. Chan said there are 3,170 known COVID-19 infections in the state, the lowest number since November 13th. Current hospitalizations are down 159 in the lowest since December 6th. Chan said the state is averaging about 350 to 400 new infections each day, and that average has been decreasing in recent weeks. But he said it still shows that the coronavirus is circulating in the community, so migration measures such as mask wearing and avoiding gatherings must continue. The state is still rolling out vaccinations, but Chan said it will take months for vaccinations to be widespread enough for restrictions to be eliminated. He said that if the infection rate declines enough, it will be possible for healthcare workers to once again investigate all cases and work to contain the virus rather than simply mitigate it. Governor says vaccine scheduling problems largely resolved. State still reaching out to some. Timely appointments available for all who need a second dose, Sununu said. Let's take a listen to that video from WMUR News 9.
Now through February 11th, join Planet Fitness for no enrollment.
With all this variety, you can move it in our clean and spacious clubs. America, your fitness is essential. Join today for no enrollment, $10 a month, no commitment. Hurry, deal ends February 11th.
Thank you very much. So as you can tell, all very good news. We're definitely trending in the right direction in a variety of different areas. Let's just talk a little bit about the vaccine rollout, and we'll open up for questions in a moment. As was mentioned, as Dr. Daly mentioned that, and as we announced last week, we had a bit of a scheduling snafu last week. Hats off to the team for addressing it, for owning it, and coming up with a solution within a week's time. And so we're already moving forward and again, making sure that that guarantee we gave folks last week is really coming to fruition, that if you we're having trouble scheduling your second shot, you can now go into VAMS. Please go into the system. You should have no trouble getting that second vaccine shot re-registered and reallocated either on the date it's due or at least within 7 days. We always give a little bit of a buffer there, but the vast majority of folks are getting that second shot now within a couple of days of when it was originally due. So again, we apologize for that, but I think the team did a great job. A lot of long hours of keying in all these new dates and times for folks and making sure it's available. So go on to VAMS if you haven't been able to yet. There were maybe 10% or so of folks that were in the system that was affecting, and that has been cleared up. Also, starting this past Sunday, we started when people get their first shot, we no longer ask folks to go on to VAMS and schedule their second shot. We're essentially pre-registering everybody for their second shot. We've also expanded our hours at 11 of our state-run fixed vaccination sites. They've now expanded their operations to 12 hours a day. Seven of those are now 7 days a week. So we're expanding times, we're expanding opportunity as we get more vaccine, and that just, I think, is creating the ability for us to get the vaccine administered even faster. So as the federal government gives us more, we're making sure that we're responding in kind and getting the vaccine out as fast as we possibly can. In addition to increasing the number of appointment times available, the number of the New Hampshire National Guard continues to, as they continue to train additional soldiers to increase those staffing levels, and that's been very, very important. Making sure that wherever we need to find the staff, we're bringing them in, we're training them, we're making sure they have the right messaging. It's going very, very well. Not perfect. Nothing's ever perfect. I think Perry Plummer and I tend to be in the same category of we don't demand perfection. We do expect it, though, and we expect it of ourselves most of all. And so we're just trying to make sure that when folks go to that site, that those assurances are there. We want to take that anxiety of rescheduling or even trying to schedule the second dose off of folks. And so far, it's going fairly well. So we talked a little bit about the possibility of increasing weekly doses. We are going to get more vaccine, maybe 5 or 10% more. We don't know exactly how much, starting, I think, next week or the week after. That's great. But over and above that, there's now a partnership here. It's across the country, but we're doing ours a little differently with Walgreens. We have Walgreens in many of our communities across the state. And Walgreens, over and above what the state already receives for vaccine, will, starting next week, receive about 3,400 additional additional vaccines. And they're partnering with us to make sure that we can compress the time that folks in Phase 1B have to wait for their first shot. We know that there's a lot of folks out in April and maybe even early May that have had to schedule their first shot given the limited amount of vaccine that we've been receiving from the federal government. Walgreens is now going to partner with us, whereas we are going to start at the back of the list, those that are furthest out, and start directly one-on-one calling them and rescheduling them to go get their vaccine at a much earlier date, and using Walgreens as our partner to administer that. It will currently start at about 3,400 next week and could potentially grow in the following weeks. But again, it's just another opportunity we're trying to create, and it gives us a lot of hope that we can really get all these first shots in the allotted time that we pre-schedule, that February-March timeframe. It's really about making sure that everyone in Phase 1B has an opportunity for at least their first shots, and this will start taking the folks furthest out. So listen for your phone to ring. We're going to start on that list. We have folks at some of our staff out of Department of Transportation have been just phenomenal about helping us. They've been on the phones. They're reaching out to folks very aggressively with our list, calling them and saying, hey, we know you were scheduled out in April. Would you like to come in and get your first vaccine as early as next week or the week after? So that's just a great opportunity. We're really leaving no stone unturned, and we just want to thank all the state employees and the various folks who have stepped up to make those calls, really kind of do the one-on-one. There were also a few other folks that maybe we didn't have their email in the system correctly, or maybe there was some incomplete information. There were a few thousand of those individuals. And again, I asked the team to reach out on a one-to-one basis, call them personally, fix their information, make sure it gets complete into the system. And those folks that were incomplete and having trouble getting their first shot scheduled, again, we're reaching out very directly. So please, if the phone calls and it's from the state and you're waiting for some better information on vaccination, take the call. Our team is there to help, and we'll get you registered for that first shot, and then the second shot will come automatically, through that process.
Okay, and there you go on that video. COVID-19 vaccines soon to be administered at Walgreens. State to sign people up. Granite staters can soon get COVID-19 vaccinations at Walgreens. The pharmacy chain said it will start inclusion Friday in New Hampshire as part of a federal program. Walgreens, over and above what the state already is receiving for vaccine starting next week, will receive about 3,400 additional vaccines, and they are partnering with us to compress the time folks in Phase 1B have to wait for their first shot, Governor Sununu said during a briefing on Tuesday. Anyone with a Walgreens appointment must meet current state guidelines for eligibility. The state is in Phase 1B of vaccination, meaning anyone 65 or older can get vaccinated, along with younger people with 2 or more combined that are their risk for serious illnesses. State officials said they will be scheduling people for appointments at Walgreens, starting with those who have already booked the latest appointments. For example, someone who could previously only find an appointment in April would likely be among the first to get a call for an earlier appointment at Walgreens. Walgreens is going to partner with us, and we will start at the back of the list, calling them to reschedule them to get their vaccine at a much earlier date, Sununu said. Eligible Granite staters can also continue to register for vaccination appointments through the vaccines.newhampshire.gov or by calling 211. State health officials said vaccine shipments to New Hampshire have increased, and they hope to pick up the pace of vaccinations. lawmakers consider police body camera and warrant reform legislation. Let's take a listen to that video from WMUR News 9.
And lawmakers in Concord continue to work on new law enforcement policies. The House Criminal Justice Committee is looking at proposals to provide grant funding for body cameras and to end the controversial practice of no-knock warrants. The committee has already rejected a bill to ban the use of rubber bullets and tear gas. In order to get bipartisan legislation, House Bill 471 would make all police disciplinary hearings public.
And if we cannot have transparency, it just creates more and more distrust.
The state Senate is also working on separate legislation for police reform.
Okay, and there you go on that video and that report. Senate votes to proceed with Trump's impeachment trial. And that is breaking right now. Senators vote 56-44 to continue with the trial. And we're going to switch gears now. Let's go into sports. In sports, the Boston Celtics, they have a game this evening. The Boston Celtics play tonight at 10 o'clock p.m. at Utah Jazz. And you can watch tonight's game on TNT, NBC Sports Boston, and NBC League Pass. Let's go Boston Celtics. Hopefully the Boston Celtics can win tonight's game. And that is it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your evening. See you back here tomorrow for another broadcast. I'll have news report coming up in a little bit. Good night and goodbye.